Social Work and Substance Use by Ash Knapp. We'll look at several points in our exploration of how social workers can work with people who are using substances, the history of social work and substance use, how perspectives towards the use of substances have changed through history, early social workers involved in this movement, what the NASW has to say, ways that modern social workers can help with people who are experiencing substance use disorder, drug courts, reducing stigma, being aware of racism, ways that we can change our language to reduce stigma, social work and law enforcement challenges, and consider my own personal experiences and reflection. I found it impossible to separate general social work from substance use social work when I looked back in history. This quote from 1926 from Harry Hopkins explains it well. The fields of social work and public health are inseparable, he says, and no artificial boundaries can separate them. Social work is interwoven in the whole fabric of the public health movement and has directly influenced it at every point. While we're thinking about history, it's very useful to know some of the substance use policies that this country has enacted, as well as the consequences of some of those policies. One of the early ones is the Opium Exclusion Act from 1909, which actually set the stage for racism in drug enforcement because it illegalized the smoking of opium, but not any of the other ways that people at the time used opium. And smoking opium was generally done by the Chinese immigrant population, while using opium in other ways was done by everyone else. In 1914, there was the Harrison Narcotic Act, which required you to have a doctor's prescription for any medication that had narcotics in it. In 1920, we have the 18th Amendment and Prohibition, which I didn't know did not illegalize consuming alcohol. It just illegalized the sale, manufacture, and transportation of alcohol. In 1933, the 21st Amendment repealed prohibition. In 1937, we have the Marijuana Tax Act, which was followed by a lot of much more severe criminalization policies that happened around marijuana in the 1950s and were also racist and prejudiced. Then in 1971, the war on drugs begins, which caused extreme racial and gender inequity in incarceration in this country. Attitudes toward substance use have changed over time. In the late 1800s, substance use was still seen as a moral failure. But in the early 1900s, social work moved into the progressive era, and people started asking for social reform and seeing that systemic issues were part of people's problems. The first social work code of ethics was adopted in 1947, and then the profession moves into the values period, during which time social work was trying to define what the profession's core values were and how people could separate their personal from their professional values. In the 1970s, several important organizations were formed: the National Institute on Alcohol Abuse and Alcoholism, the National Institute on Drug Abuse, and an organization that would become the Substance Abuse and Mental Health Services Administration. This was very important because once there were these national organizations, it lent legitimacy and validity to the idea of working in substance use as its own field. Early social workers and substance use. We know that public health and social work have always been intertwined, which also makes it almost impossible to separate the two and to find social workers who were specifically focused only on substance use. One name that comes up many, many times, even though she wasn't focused only on substance use, is Mary Richmond. She was one of the first people to say that addiction is not a moral issue, that addiction is an illness, and what we need to do is advocate for identification and treatment. Over time, there began to be more and more of a recognition that substance use was its own field, and the NASW took steps to support this. In 1995, it started a section for people whose practice was solely in the field of substance use and issues around that. And the idea was to help people create professional competencies for working in this field. Like all social work, these competencies include the idea that the client is part of their own treatment and that an approach needs to be supportive and include education, advocacy, and intervention. Another important historical change was when the DSM-5 came out in 2013, and it said that substance use disorder occurs along a spectrum. It no longer had to be defined as dependence versus abuse. This was very important because now many more people could be considered eligible for resources and help. There are lots of ways that modern social workers can contribute directly to improving the field of substance use. One way is by reducing stigma. There are about 22 million people out of a population of about 342 million people in this country who are dealing with or who have dealt with substance use disorder. This is almost 6% of our population. With it being this common, substance use should not be so stigmatized. Stigma causes underutilization of harm reduction programs, and it also causes underutilization of emergency programs such as 911. We had one patient at the office where I worked who overdosed, and instead of calling for help, his friends all ran because they were too scared. Another way that social workers can be involved in the field of substance use is in drug courts. Drug courts are solely for people who have drug-related convictions, and they're supposed to be non-punitive and collaborative. The first one came out in 1989, and they were so popular and found to be so effective that by the year 2013, there were 2,700 of them. The idea is that the judge, the social worker, law enforcement, and the individual all work together to change behaviors. And some of the specific ways that social workers are involved is through supervision, drug screening, helping people meet their goals, and advocating for social justice. Dr. Vicaria wrote a book called The Harm Reduction Gap, and she works in drug policy reform. And she speaks about the very important idea that racism is a part of substance use policies and law enforcement. She says that substance use treatment is a social justice issue. For example, methadone and buprenorphine are both used to treat opioid addiction, but methadone requires going in person every single day to a clinic, while buprenorphine can be prescribed by a doctor and taken at home. Often, people of color are the ones who have access and ability to use methadone, while white people are the ones who have access and ability to take buprenorphine. She also studied Latinx communities, where she said these communities suffered increased negative consequences of drinking, even though the amount that people drank was overall less than in other populations. She said that this leads to a vicious circle. People drink because of being excluded from society, fear, difficulty getting health care, difficulty getting mental health care, and because there's racial disparity, there end up being more bad consequences that happen to people in these groups, which then leads to more drinking. Again, a vicious circle. Dr. Vicaria says that substance use policies have often been used to control individuals and populations, and that social workers need to bring this awareness to the work that they do with their clients. There are several challenges for social workers and for law enforcement agents when it comes to the field of substance use. Law enforcement are taught that overdose victims are criminals, not medical emergencies, which changes how they respond sometimes in situations. Social work is based on white middle-class Protestant norms, which will change, even if it's unconsciously, how social workers respond to anyone who doesn't fit into those categories. Also, social workers are often caught between upholding human rights and following compliance requirements that are set on them by their profession. Finally, social work and law enforcement both take place within a system that sometimes blames individuals, and when you're working within this system, it's hard to see systemic racism and historic or societal influences on people's lives. One easy way to start to change the stigma around substance use disorder is to change the language. Don't say addict, junkie, user. Say a person with a substance use disorder. Don't say popping dirty or coming up clean. Say that someone is in remission or recovery or is abstinent. Don't say drug habit and drug abuse. Use the terms drug use or drug misuse, and don't say former addict. Use the term person in long-term recovery. My personal perspective comes from 2 years working in an addiction medicine office, interactions with a friend who just celebrated 1 year sober, and my personal contacts with people who are or have had substance use disorders. There are a lot of things that don't work in our current system. Access to care is a huge problem. People don't have cars. People who live rurally don't have public transportation. When insurance provides rides, there are issues with stigma, mental health, and anonymity, and missing work and missing income to make it to an appointment adds a lot of challenges. Stigma is still rampant. Anonymity was a priority for so many of our patients, and if they couldn't guarantee anonymity, they just wouldn't come into the office. Some of them were treated really poorly at the pharmacy. Some of them were treated really poorly by their insurance drivers, the people who were provided by the insurance company to give them a ride since the patients didn't have cars. And I've also seen stigma in social work profession among social workers and among social work students. But there are some things that really do work. When providers care, it makes a big difference. One of the doctors I worked for had been in general medicine, and when I asked her why she added her license to prescribe buprenorphine, she said, well, we were taking care of people in every other way, and it just felt like, why wouldn't we also provide this service? As far as receptionists, I think we all know what it feels like to walk into a room and have the receptionist either make you feel great about the fact that you showed up to your appointment or make you feel terrible. From the LGBTQ+ community, we can borrow the saying, be careful who you hate, it might be someone you love. With 6% of the population dealing with or having dealt with a substance use disorder, chances are there are a lot many more people who are dealing with this issue than we consciously know about. And then finally, there but for the grace of God go I. Substance use is not a moral failing. It comes on people due to a lot of other factors, and any of us might experience this at some point in the future. I learned quite a lot doing this project. It was really good to look back at the history of social work and substance use and to see how intertwined they are, to think about the changing perspectives through history, early social workers who were involved, and how and when the NASW jumped on board in supporting work in this field. It was also good to think about modern social work and substance use in terms of drug courts, stigma, and racism, to learn ways in which we can change our language, to think about specific challenges to social workers and to law enforcement, and also to think about my own personal experiences with this subject.